Welcome to HealthTech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are excited to welcome Everett Steele, a senior technology leader and senior vice president of operations at ChartRequest. With extensive experience in healthcare, IT, operation, and product development, Everett has driven innovation through scientific vision. His journey includes founding a startup, serving as an army officer, and leading digital consumer product teams through transformative growth. Welcome to HealthTech Heroes, Everett.
Thank you so much, Foss. It is a pleasure to be here. Great to get to know you a little better. And I'm really looking forward to our conversation.
I'm very eagerly looking forward to this conversation. You started as an army officer, and this is about HealthTech Heroes. And I would love to hear that origin story. What made you transition from army to healthcare technology?
Sure. I think I have to go all the way back to the beginning. I grew up playing video games on the Nintendo in the 80s and writing software on an Apple II in my bedroom in the 90s. And it's because I've always been drawn to systems. And, I love cracking the code on how a system works. And something deep down that I believe is that we all have a debt to the world that we incur when we are born, right? And it says that we must leave the world better than we started with it. And when I realized that my skill in life was figuring out systems and reducing complexity from large scale to simple, I just started applying that. And so in about 2004, 2005, I decided I could take those talents to the Army as a fresh college graduate and change the world. I may have been a little naive that a 21-year-old former college student could do that, but I learned a lot, right? And once I got done with my time there, I kind of went back to the world of technology. But the thing that's always ran through my career, the kind of central thread, is service. And it's using the talents that I've been given and that I've developed over my life to serve the world and to leave it better. And so, I think when it comes to healthcare and sort of the transformational arc there, there are so many amazing people working in healthcare. And the challenges we face in healthcare are not a lack of effort or a lack of intelligence or a lack of good people who believe in making the world better. The challenges are redundancy. We lack coordination. There's a million standards and a million systems and a million dashboards and a million protocols, and we need to reduce that complexity. And I think, if you look at it through that lens, I think this journey to me makes perfect sense. You can see how looking at my resume and looking at LinkedIn, it might seem a little disjointed, but I see the thread there.
It resonated. Leave the now better than you found. Simple goal, right? It's a very simple goal. You just leave it
Just
better
save the
than
world.
you found it.
It's easy.
Yeah. Or save the world. Yeah, ultimately. Yeah.
It's easy.
That's probably my 20-year-old version. But right now, let's leave this situation a little better than you found it. So one thing that I want to ask is, you have been a founder at some point, and as a recovering startup founder, I'd imagine, what are the key lessons that you would give to new entrepreneurs who are getting into this industry, right?
That's a great question. I think so. I have started a couple companies. Some have reached a good level of success. Some have been absolute failures. I would say I have learned a lot more from the failures than the successes. When I was in the Army, I was in the cavalry, so it used to be horses. And one of the things we would say is, you barely learn anything the second time a horse kicks you. Right. And so it's these failures that you take lessons from. And I think the biggest one from failures in startups that I have learned is don't fall in love with the product. Don't fall in love with the idea. Fall in love with the problem that you're solving. Fall in love with the customer that you're helping, right? Like, people always use this phrase, the customer's always right. And they use it wrong all the time. They often use it to mean like, I can go into a restaurant and be a jerk, right? But that's not what it means. It means if you own an ice cream shop and you sell vanilla ice cream and a customer comes in and says, I prefer chocolate, it's a fool's errand to try and convince them that vanilla is better than chocolate. You need to go across the street and buy chocolate and sell them that, right? So it's about meeting your customer where they are. And so many times in my career, I've talked to a young startup founder who has told me, the market is wrong. I'm building the solution. I'm building the thing people need. They will come to me. And as much as I love the movie Field of Dreams, if you build it, they will not come. You've got to build the thing that people want.
That's amazing. And sometimes I would imagine that the pain point, people who are in the industry, because they're so used to it, may not realize that they have that pain point, but identifying pain point is also important. It's very important for us to dig a little deeper and actually find that particular pain point and address it.
I think that's exactly right. I'm not doing it right now, but I try and ask more questions than I answer.
I try to operate on the 5 whys, like, hey, why do you want this? Why do you want this? Why do you want it? It's the 5th time that you arrive. at the right answer. You don't learn anything new when the horse kicks you the second time.
That's right.
I just made a mental note on it. I need to digest that. I don't want to be kicked the
Yeah.
first time or the second time,
No,
but
right. It's best to avoid the first kick, but it's way better to avoid the second kick.
so you have worn multiple hats from user experience director, chief of staff, and you have worked at Atlanta City Council. Is there any mindset you bring from these diverse experiences that actually make you see health technology in a different perspective?
I think so. I think, I had the great pleasure. I served as chief of staff for Andre Dickens, who is now the mayor of Atlanta when he was on city council. And it was a graduate study in systems and policy and how the systems that exist and the systems that we have built over decades, if not centuries, they often fall short for the people who most need them, right? Some of the most vulnerable people in our societies are not well served by the status quo. And that is a very government, progressive way of thinking, but it's true in healthcare, right? The people that we're dealing with, whether it be the actual patients or their care providers, their care team, their families, these people are often at one of the worst times in their entire life, right? They are dealing with the loss of a loved one, a change in their quality of life, a change in their health. And, it is our duty to center them, just like we center humans in our design, is to center the person in our solutions. And that's true if you're working in government. That's true if you're working in software. I think sort of how that experience shaped me and others, with my startup, I did a logistics software back before on-demand logistics was cool, which maybe we were a little early or whatever. But, it kind of draws back to this idea that again, centering the person, centering the problem, and centering, listening in your solution ideation, it's just applicable and it just works. And being focused and being consistent in how you do that is what makes you create or enables you to create good operational clarity, I guess would be a good word for it.
What I hear here, I think, is a critical part that you have learned from your experience at the government office is that you're looking at the pain point of individuals. And going back to your previous point, if you look at the product, you're saying that, hey, this might be the most profitable product, but that may not work in your favor because you're not actually concentrating on the pain point. And since you're coming from a government sector, we are not looking at profits. We are starkly looking at the pain point. I think that might be something that you are bringing to the health technology, that you are starkly looking at solving the pain point, and you're bringing that to the industry.
That's interesting. If my boss is listening, I want to be clear, we are focused on making a profit here at ChartRequest, but we just like to do it in a way that also benefits people because we are a values-based, values-driven organization.
Absolutely. I think I don't mean to say that you're not going to make profit, as you alluded to the previous point for the entrepreneurs, that if you address the pain point, that's where you are going to be successful. So you are leading multiple critical functions. How are you leveraging technology to transform healthcare information management at ChartRequest?
I mean, for us, technology is everything that we do. We see technology in, I think, possibly a unique way compared to others in whether it be technology, healthcare technology, et cetera, is, we see technology as a force multiplier that takes the efforts of people and leverages it into a much larger impact. I was at a conference this weekend that was fantastic and I loved it. I heard a lot of great speakers and talked to a lot of great people, but a lot of the newer companies, the sort of innovative younger companies, I was talking to a lot of young folks who were saying, our software is the key, right? Our software will change the world. Our software will do this. Our software will do that. And look, I mean, I know we're on a nascent edge of AI or large language models changing the world, and we certainly use that at ChartRequest, but it's not just software, right? I tell people this a lot. Like, if you need medical records and you have a 100% mandate to get every record that is in the search of records you're doing, software can do a lot of it, but there are records that are printed on pieces of paper sitting in the basement of hospitals. I would love to find a piece of software that can go down that basement with a flashlight and find it. Now, I don't want my people going to the basement with a flashlight to find it either. Don't get me wrong. But it's the synergy and the hybridization of the power of people and the power of technology to create a force multiplier that allows people worry about AI taking their jobs. I think AI makes me so much better at my job. I use it all day long, every day, right? It's how do we make humans more powerful? Humans can travel faster by car than we can on foot, and no one's mad about cars. Well, people are mad about cars, but that's neither here nor there. But it's how do we leverage technology to be a force multiplier? And I think that's what we're doing at ChartRequest that is transformational. We are merging the power of people with the force multiplication of technology. And, the results speak volumes, I think. We're not automating purely. We're not brute forcing purely. We are coordinating across multiple work streams, I guess would be the simplest way of saying it.
That's a really good point that you're making. I am almost tending to see artificial intelligence as an augmented intelligence rather than just artificial
I
intelligence.
love that.
This allows us to go to another level of creativity because our level of creativity might be taken care by the augmented intelligence. Now we have time to think beyond a certain level.
I was a skeptic at first. I've been around technology long enough to keep hearing this is the next big thing. This is the next big thing, whether it was blockchain, Web3, distributed peer economy, all these things. And man, I have drank the Kool-Aid. I use ChatGPT hundreds of times a day. I mean, I use it, and I hope my wife doesn't watch this. I had to draft 5 versions of a birthday card message for her a week or two ago because I thought it's going to start at a great place. If I get an 85% solution and I craft it from there, I use it for practical tasks around the house. I mean, it is a force multiplier that I am very supportive of.
100%. There are so many tools and it keeps evolving every single day. All right. So my next question is basically the offering from ChartRequest and also leveraging your experience in the user experience design. How does this influence and how does your offering at ChartRequest is an enhanced offering for your clients? Like what exactly is that you do different for your clients?
Sure. Well, I think right off the bat, I think ChartRequest has a huge advantage, not necessarily over our competitors, but just in general, in that because we offer sort of 2 tiers of service, we offer our software driven by our people, and we offer our software used by our clients' teams. And because of that, some of the biggest, most day in, day out power users of our system work for us. If you tell every product owner, every product manager in the world that you write the paychecks for the people that use your product most often, their eyes would go wide, right? It's a huge opportunity. So we leverage that, right? Like I am a big believer in, we measure what matters at ChartRequest, so we get feedback from our users. My chief of staff now is shadowing one of our teams this week in several long sessions to see what's working, what's not. How do we fix what's not? How do we see what, not just software, but what workflows are they using that might be better for our clients? How do we publish that information out to the people who are using our software? I love products. I think, iterative product design is the core, the crux, the driving principle of good product design. I think you take any beloved product from the iPhone to the Porsche 911 to the Mona Lisa. How many versions of the Mona Lisa are floating around? He didn't get it right on the first one. He tried a lot of styles, and we still keep finding new ones, right? And I think that's exactly right. Like if you build the perfect product, or you tell me you built the perfect product on your first deployment, you are crazy, lying, or something in between, maybe a little of both. It's just not true. And so we take that, I was on a 2-hour sprint review this morning, right? Where we talked about, hey, here's what worked great this sprint. Here's what failed and sucked. Here's what we can do better next time. And we do that every 2 weeks. We do data reviews every Wednesday morning. I do an executive data review every Tuesday morning. I mean, we iteratively build this product better every single week. And, our customers notice it, people feel it. And, I would encourage everybody out there who's building software or building anything to use that approach, or at least explore it and see how it fits in your, operational framework.
That's a really good advice. We try to be perfect for the first time. I think it might actually go back to the idea that build your foundations, right? Get it started and then slowly start adding. Help me walk through a good win that you had with a client and how was their experience? Connected to it is when we talk about wins, I think the other side is also challenges. What kind of challenges is ChartRequest facing in the marketplace?
Sure. I think, in terms of a good win, as we mentioned earlier in the call, to me, a good financial win is fantastic. But what I really love hearing is, when I go to a conference, shaking hands with someone and hearing from them, my life is less stressful because of your product, right? And so, I think in particular one, very large practice in a, very specific specialty who, kind of came to us, I don't want to say in shambles, but they may say that, right? And their operational, frameworks were all over the place. They were using multiple different vendors to do stuff that we can all do under one roof. And, one of the things that we do, we have our client services team, they are part sales team, they are part operational team, but really at their core, they are an internal consultation team. And our VP of client services, our director of client services, they will fly out to see a customer. They will sit in their room and say, hey, show me what you guys are doing. And they all have, collectively 100 plus years probably of industry experience, and they can say, wow, the way that you're doing this, that is not the best way you could be doing it. Try this instead. And I've been in rooms for these conversations countless times, and it is so impactful to me. It keeps me fired up about what we're doing, to really see people's eyes light up and be like, wow, we've been doing it this way for 10 years. Good Lord, had I done it different from the start, the way you've showed me, how different would my life be? How much more profitable would my company be? How much better would our patient outcomes be? How much lower would my stress as a human being be? And so I think that sort of, bespoke, what do you kind of call it, a consultancy or advisor, that's a level of service that frankly no one in our segment of the industry is doing. And hopefully they all listen to this and don't start doing it. But it's a key to success. And I hear that story from people all the time, and it just means a lot to me. We are growing. So we are triple digits now, have been for some time, and probably will double where we're at now by next year. And the challenge is, how do you scale and how do you protect yourself against complexity? I have observed this. I mean, I have hired certainly hundreds, if not thousands of people in my life. And I see this all the time. People come into a company and they bring with them, hey, you know how we did it at company before was great. We need to bring in a new system to do our payroll. We need to bring in a new system to do our project management. And we go from this idea of like, we've got too many systems to now we have too many systems plus two more, right? So it's how do you scale without losing simplicity in your operations? And how do you keep it continuously scalable without building a spaghetti network frame of 100 interdependent systems and nobody's even, I mean, good gosh, password management is a pain in the butt, right? Right. Just little stuff that if you want to be secure, you want to be HIPAA compliant, you want to protect your data and your customers, managing passwords is a beast. And we have a whole section of people who kind of work on this and develop new protocols and work on it. And so, I think the challenges are myriad, but I think if we stay true to kind of our ChartRequest ethos of operation, which is simplicity is key, scaling is key, customer service is key, we can chart through them, and I think that's kind of how we continue to operate and continue to scale, without losing the focus on what we really, really care about, which is the customers, right?
You said something like there are too many software and there are two more. And to manage that, you need one more software to manage
Just
those
one more will
passwords.
solve it.
So I see you as a thought leader, Everett, and this question comes
Well, thank
from
you.
that perspective. Given your extensive background in both technology and healthcare, what trends do you see emerging in healthcare IT over next 3 to 5 years? Where do you think we are going to be?
It's really good. I think the gut reaction that probably anyone would say is like AI. And I believe that, right? We've talked about it. We use it. I heard the word AI. One of the people at the conference this weekend did a raffle to give away, like a giveaway. And they got up there and they said, we used AI to pick a winner. So what does that mean? A random number generator? Like it's the buzz. But I do think there are huge opportunities in AI in healthcare. I don't think we're ever going to see AI summaries becoming legal standard documents. I don't think we're going to see clinicians relying solely on an AI, patient encounter summary. But I do think from the patient perspective, if I could go into a system right now and say, hey, when I had my shoulder scoped in March of 2019, what did he tell me not to do? And get a clinical summary, not divested, but translate into words that I understand. I'm not a doctor. I know enough about healthcare to be dangerous to myself, but I don't know. It's hard to know when I even was told to take a medicine. So I think, administrative and patient AI is great. On the administrative side, the stuff that we're doing, I think, is very valuable in giving people tools. And I think the other really big thing, I think this is really big, and it's kind of to our prior point, which is API driven, like interoperability is becoming table stakes, right? Like to the exact point, like how many EMRs exist in the world? I don't know, 7,000. How many, ROI solutions? How many retrieval portals are there? Another 7,000. But if we get to a world where those can all talk to each other through a standardized interoperability framework that treats, a medical record from one provider as a medical record from another, as an image from another, and we have that, that is going to become table stakes. And if your company is not building that today, you are already way behind the companies like ChartRequest that are doing it. And I would put some time into it.
You are saying all the administration part, all the operational part, a lot of it will get a lot more standardized, but the skills part
Absolutely.
will still need. So it is basically
100%.
in the next 3 to 5 years, you see this going hand in hand, and it allows the trained professionals to do what they do best.
Exactly right.
This is a little bit coming from a healthcare leader's perspective. The question for you is what advice would you give to emerging health tech leaders about building and scaling successful healthcare solutions? Some unconventional ideas are preferable, but conventional are also good.
That's a good one. I think, okay, this is unconventional. Here's what I would do. If I were starting at ground zero, I would think about my customer's pain, and I would think about it, and especially for healthcare, think about it like you are a clinical care team for that problem, right? Build a support team, a care team, build out, almost like you are a support group for what's hurting your customer. So come at it from different angles. And so you want to ease the pain, right? You want to have palliative care. You want to triage and make sure this person isn't going to die on the table because you overlooked a major pain point. Come at it from that angle. I think that is huge. And I wish I could go back in time and do that better retrospectively. I think another thing, and I think I touched on this earlier, but it's like, don't fall in love with your product. And also don't confuse the term used by with loved by, because the end user of your products, right? The administrator in a clinic, the nurse at a station in an urgent care department, they may be using your product, but have you asked them if they loved it? They're probably using it because their boss, their practice manager, their nurse manager, whomever told them this is what we use, so use it. So go to those people and ask them, do you use this product or do you love this product? Because if they don't love it, they're going to tell you exactly what you need to hear to find out how to get them to love it. And if you build what they love, they're not the buyer, they're not the money holder, the check writer, the decision maker. But if you think that those people don't have massive influence in these organizations, you don't understand your customer and you don't understand this industry, would be my thoughts.
I think it changes the KPIs, the way we look at the KPIs. Are we looking at 1,000 users? Or are we looking at also 1,000 lovers of a product? And those are two different metrics. And very often we end up using the metric of like, hey, we got 1,000 users. We also want to know that what percentage of those users, regular users, just love it or they're okay with it. I think differentiating that, and people who are just okay with it are the people who you got kicked by the horse for the first time, right? That is where your learning comes from. So
we have a phrase that we use at ChartRequest that I use a lot, and I know my team hates hearing at this point probably, but it's measure what matters. And I think too often people will look at what I kind of call vanity metrics. And, you put it in the context of a podcast marketing department. And they can come back and say, hey, we had 20,000 listeners this week and all of them listened to the entire podcast. And if your goal is to have podcast listeners, that's amazing. But if your goal is to use a podcast to sell a product and nobody went from that podcast to that product, that's a vanity metric. That's like having big muscles that aren't that strong, right? At the end of the day, they don't help you. And so measure what matters is something I probably say 10 times a week and probably will till the day I die. But I think that's kind of at the core of what I was getting at, really.
That's awesome. And the message was very clear when you said this. You just left me at a point where I came to that conclusion. So before we wrap up, Everett, you will have 90 seconds to share anything you'd like to highlight for our audience. It does not have to be 90 seconds, but
sure.
Yeah, go ahead. Yeah.
I mean, first of all, Fasa, thank you so much for having me. This was a delight. I don't get enough opportunities to come out of my little operations shell and actually talk to people who don't work at ChartRequest and who are not our customers. So it's always a great pleasure. But, I think if there's something I can leave the audience with to kind of bring this all together, it would be in healthcare technology, like, we don't need more dashboards, right? We need more delivery of services that reaches patients and providers and retrieval requesters where they are, right? And so at ChartRequest, like, we are focused on solving those kind of invisible problems, those invisible barriers between providers and care, and things that delay that care, things that create bottlenecks. We are trying to burst through all of those, right? And so for people who are building this industry, solve boring problems, right? That's it. That's where the impact is. And that's where no one else is going after it. And it's not that there's not lots of money in boring problems, but they're not sexy and people move away from them. Solve the boring problems. And so if you're a provider, a startup founder, if you want to just know about where healthcare is going, reach out to me. I would love to have this conversation with other folks. I'm on LinkedIn. I'm on chartrequest.com. But that would be my final words would be get out there and find the pain that people are having, find out what people love using and build things that marry those two. And the success, the money, everything else will follow that. I truly believe.
And with that, Thank you very much, Everett. I
Thank you.
just love this conversation. There are so many golden nuggets that you can
Likewise.
take home.
Likewise. Thank you. That was a great conversation. I really appreciate it.